Okay, this is a video lecture discussing the immune system. This is in chapter 21 of your textbook, and there will also be some online quizzes to follow. So when we define what immunity is, it's the resistance of disease, and it works with the lymphatic system, which we talked about in a separate discussion, and that's basically how the immune system is able to circulate and cells can communicate is inside of the lymphatic organs as well as being transported throughout the lymphatic ducts and vessels. And we'll talk specifically in this lecture about the cells of the immune system. So we'll be mostly focusing at the cellular level. So looking at the immune system, we have what's called the innate or non-specific defense system, and then we have the adaptive, which is more specific to the particular antigens that the body encounters. So this is a great flow chart. I would highly recommend that you know how this is arranged, know basic differences between innate and adaptive defenses, differences and examples of surface barrier and internal defenses, and then differences between humoral immunity and cellular immunity. So we'll kind of keep revisiting this slide as we go through the PowerPoint. So key thing, just starting off, is know that the innate defenses are non-specific ways our immune system attacks foreign particles or invaders. So these are non-specific, which means they can't identify a specific virus or bacteria. It's just general ways of, if something is foreign, the body attacks it. The adaptive defenses, on the other hand, are very specific, which means the cells have to recognize the antigen as foreign, and then there's a series of steps to destroy that antigen or the cell. Sometimes we have cells that become infected with viruses, and that would require a specific pathway to destroy those virus-infected cells. Cancer cells, too, need to be recognized specifically as cancerous and destroyed. So the adaptive defenses are very specific in how they attack foreign or infected cells. So starting off with the innate defenses then, this is our non-specific branch of the immune system. There's two major categories of how we non-specifically attack infection or foreign invaders, and one is surface barriers. Our skin and mucous membranes are set up specifically to provide a barrier from the outside to the sterile inside. So we call the surface barriers our first line of defense. So the skin, the mucous membranes are the first line of defense in protecting us from our environment. So if we look at some things within the body that are protective chemicals, our skin is slightly acidic, and we have acidic saliva as well, and we have enzymes that destroy bacteria. We find that in our saliva, in the respiratory mucus, in our tears, the lacrimal fluid, which helps to kill bacteria. Those are specific enzymes. And we have antimicrobial compounds that also act to destroy bacteria, and defensins are found in the saliva, which help reduce bacterial growth in the mouth. And then we also see other chemicals in our oil that is secreted from the sebaceous glands, and also in sweat. So if we think of how this applies to our patients, anybody with dry skin is going to have a breach in that surface barrier, because dry skin is more subject to cracking, and we're losing that protective barrier. And any patient that is not eating anything, that they have less saliva production as a result of that, and that's going to increase the bacterial count in their mouth. So any patient that is what we call NPO, which means nothing by mouth, or has an NG tube where they're not actively chewing and eating, that's going to reduce saliva, and that's going to put them at risk for infection. We're reducing the effectiveness of that surface barrier in the mouth. So therefore we want to always make sure we're giving them good oral care and cleaning out the mouth with maybe sponging with a swab dipped in like a mouthwash would be beneficial. And there's special mouth care kits that you can use for patients that are not able to eat anything. Other surface barriers, we see the mucus that lines the nasal cavity and the respiratory tract, that also those cells are ciliated, so the cilia traps bacteria. But in smokers, that is one example of a breach in that surface barrier, because the cilia become non-functional and reduced in number in people that are chronic smokers, so they are losing that barrier for infection. So smokers are more susceptible to sinus infections and respiratory infections, and a typical cold can turn into pneumonia or bronchitis very easily because of that lack of a surface barrier with the functional cilia. Our second line of defense then, still nonspecific, this is still the nonspecific branch, but these are cells that can actively attack. So if the surface barriers are breached, if you cut yourself, then the immune system has to go to the second line of defense, and that's the cells of the immune system, which are, many of them are macrophages, neutrophils. These actively phagocytose, which means they ingest bacterial or foreign antigens that are free floating in the tissues and blood. So this is again the second line of defense. So macrophages, this is what's shown here, macrophages have these cytoplasmic extensions that can reach out and grab bacteria, and then it enters the cell and is broken down by enzymes. Those enzymes would be lysosomes inside the macrophage, which will break down the foreign antigen. So these can attack freely floating antigens in the tissues and in the blood. And we find specific macrophages with special names in the lungs and the liver that you'll learn more about if you take advanced A&P, but they're important for fighting infection when that first line of defense breaks down. So this is an example of phagocytosis. The bacterial is brought into the cell. This might be a macrophage, and the lysosome, which is present in the cell, fuses with that vesicle, that phagocytic vesicle, breaks down and destroys that bacteria, and then releases it into the extracellular environment where it's no longer causing infection. So whenever we have an infectious process that will activate the immune system, we're going to see inflammation. And inflammation is whenever we have tissue damage. It might not even be due to an infection. We can have inflammation if you twist your ankle, and that's just damage to nearby tissues. And that's going to mount the healing response by the body, which involves some immune cells. So the benefit of having inflammation, even though it's painful and can limit the use of that part of the body, it helps to spread. It helps prevent the spread of particles that could damage surrounding tissue. For example, some inflammatory chemicals are, and one example are cytokines. Cytokines come into the area, and that promotes inflammation and helps begin repair. But if we don't isolate that area with other factors that are found with inflammation, then that inflammation can spread. And we'll talk about how that spread is prevented. Disposing of cellular debris and pathogens, what we find is the increased fluid in an area that is inflamed helps push that extracellular fluid into the lymph vessels. So rather than that entering the blood, it's pushed into the lymph vessels. So that is the benefit of the inflammation. And it also alerts the adaptive immune system, and the adaptive immune system is made up of T cells and B cells, which we'll talk about, that will actively attack any antigens or infected cells that are in that area. And then again, it sets up the stage for repair, so healing can occur. So when you talk about the inflammatory response, the 4 cardinal signs of inflammation, when you should definitely know what these are and what causes it. So one is redness, and that's due to dilation. Redness and heat is due to dilation of arterioles leading to the site of injury. So we see increased blood flow as a result of those dilated arterioles, and leaky capillaries, which is going to cause redness just because of the increased blood flow, and heat because of the increased blood flow. We're going to see swelling because of the leaky capillaries causes more fluid to leak out of the capillaries into the area, and the fluid is made up of proteins and fibrinogen, which is going to cause clots to form around the area. This fibrin, not blood clots, but just fibrinous clots, or a mesh, or some people call them adhesions, which help to wall off, and that's what prevents the spread of infection. For example, when someone has a burst appendix, some people are lucky in the sense that the immune system response is so strong that fibrinogen is converted to fibrin, and it walls off that infected area so it doesn't spread. But because we have increased fibrin being formed in the area and increased fluid flowing into the area, we're going to definitely see swelling. And that can cause pain because some of the chemicals released in the process of the immune response, such as prostaglandins and kinins, are going to signal pain receptors or stimulate pain receptors. And because of that swelling and pain and redness, that can limit the function of that particular body part. So if someone has an infected knee, for example, we wouldn't want to be moving that knee a lot. We'd like to keep that swelling isolated and not spread the infection. So here's an example of the internal defenses attacking and being promoted to the area to encourage healing. So if you cut yourself, that tissue injury is going to cause inflammatory chemicals that are found in the blood to migrate to that site, and that's going to cause the arterioles to dilate, the capillaries to become extra leaky, and it's going to attract those bacterial fighters, the neutrophils, monocytes, and even B and T cell lymphocytes to the area. And as a result, again, we're going to get the heat, the redness, pain, and swelling, and be aware, too, of what's causing the heat and the redness. It's the arterioles dilating. What's causing the pain and the swelling? It's from leaky capillaries and that fluid leaking into the area. And we call that fluid in an inflamed area, we call that exudate. And it should be clear if it's a healthy fluid. If it is overly full of dead white blood cells, then that can become pus, and pus is not necessarily a good sign. Sometimes that can lead to extended infection, but a small amount of fluid in an inflamed area is, we call that exudate, and that is the normal part of the repair process. So we can see all of this is going to lead to healing. We can have these proteins leaking out of the capillaries, which again forms fibrin, and that fibrin surrounds the infected area and kind of walls it off so it doesn't spread to nearby tissues. And then if we look at the process of white blood cells coming to the area, there's a number of ways that that happens. This flow chart on the right-hand side is better described here. So as white blood cells pass by an injured area, there's inflammatory chemicals in the tissue that will attract these white blood cells to the area. So as they enter from the bone marrow, we call that leukocytosis, as the neutrophils enter from the bone marrow. Then as they near the site of the injury, they cling to the capillary wall. We call that margination. And then diapedesis is when they squeeze out between the simple squamous cells of the capillary. And then chemotaxis means they're moving toward the inflammatory chemicals, and that draws them to the site of infection. So know the order of these steps as white blood cells enter the blood and leave the blood capillaries and enter the infected tissue. Again, all part of the internal defenses. So this talks about a chemical called interferon that we see released from cells that are infected by a virus. This is another chemical that can help prevent the spread of infected cells that are infected by viruses. Another example of an internal defense. So when a virus infects the cell, the virus takes over the DNA of that cell, which will release interferon from the cell. So the cell produces interferon, which is released into the extracellular environment. When that interferon binds to a receptor on a nearby healthy cell, that changes its DNA to produce an antiviral RNA and preventing viruses from infecting and taking over the DNA of that cell. So it doesn't help the infected cell because they're already infected, but it does help nearby healthy cells from the spread of that viral infection. So interferon is another example of a non-specific internal defense for preventing the spread of infection. So fever is another way that our body can non-specifically fight infection, and it's a systemic response. So doesn't happen at the local tissue level, it happens systemically. So you can feel when someone has a fever, like I can tell in my kids, their back is hot, forehead is hot, and they're just emanating this heat. And that is because when we have foreign substances in the blood or the tissues, it could be an ear infection, it could be a virus that's throughout the body, that's causing this fever, and that is because we have white blood cells and macrophages start to secrete these chemicals which we call pyrogens. And the pyrogens are floating in the blood, and they act on the hypothalamus, which the hypothalamus is a major regulator of body temperature, and that causes the hypothalamus to raise its set point. So instead of 98.6 being the temperature at which the hypothalamus will start to indicate sweating or shivering, now the set point might raise to 102. And as a result, the body temperature goes up because the hypothalamus is not actively regulating body temperature at 98.6. And then you see the typical rosy cheeks, and sometimes people get extra tired because our nervous system is very sensitive to temperature changes, and some kids, especially when they get to fevers over 101, might have seizures. But most often, we become very tired, very lethargic when we have fevers. So those are all examples of the innate defenses. Again, they're nonspecific. They're ways that we just generally fight infectious materials that enter the body or into the blood or the tissues. And the next major branch we're going to talk about are the adaptive defenses, and these are specific. And we'll continue with that in the next video.